If someone you love takes opioids for chronic pain, after surgery, or for any reason, this video is the most important 5 minutes you'll spend this year. You don't need to be a nurse. You don't need a license. You just need to know what to do. Overdose doesn't only happen to the people you see in the news. It happens to grandmothers recovering from hip surgery, to pain patients who took their prescription exactly as written, to people in recovery who relapsed once, to the healthiest person in your family. If they breathe, they live. If they stop, they don't. Opioid overdose kills by stopping breathing. Naloxone, most people know it as Narcan, can reverse that, often in minutes. Step 1. Recognize the signs. An opioid overdose looks different from a seizure, a stroke, or someone simply asleep. 1. They are unresponsive. You shout their name, nothing. You shake their shoulder, nothing. You grind your knuckles firmly into the center of their chest, on the breastbone, or rub them hard along the bone above the upper lip. If they don't groan, don't move, don't open their eyes, they are not asleep. This is a medical emergency. 2. Their breathing is slow, shallow, or has stopped. Watch the chest. Normal is 12 to 20 breaths a minute. Fewer than 10 is dangerous. Fewer than 8 is critical. No breathing at all means seconds matter. 3. You hear choking, gurgling, or a deep snoring sound, sometimes called the death rattle. This is not snoring. This is the sound of someone drowning in their own airway. Do not assume they are sleeping it off. 4. Pinpoint pupils. Lift an eyelid. The black center of the eye will be tiny, the size of a pinhead, even in dim light. This is one of the clearest signs that opioids are involved. 5. Their lips, fingertips, or skin look blue, gray, or ashen. On darker skin, check the inside of the lips, the gums, and the fingernail beds. This means oxygen is not reaching the body. This is the late stage. Act now. You do not need to see all 5. If you suspect it, act. Naloxone is safe and causes no harm if the person isn't overdosing. Step 2. Act. Memorize this order. Call, spray, breathe, wait, repeat. Call 911 first. Put the phone on speaker so your hands are free. Tell the dispatcher, I have an unresponsive person who is not breathing normally. I think it's an opioid overdose. I'm going to give them Narcan. Give the address. Stay on the line. Most states have Good Samaritan laws that protect you from drug possession charges when you call for help. Calling is always the right move. Lay the person flat on their back on a firm surface. Tilt their head back gently and support the back of the neck. This opens the airway. Quickly check the mouth. If you see vomit or anything blocking the airway, turn the head to the side and clear it with a finger sweep. Open the Narcan. Most people will have the 4 milligram nasal spray, the over-the-counter version. There is no assembly. There is no priming. Each device is 1 dose. Do not test the spray before use. There is only 1 dose inside. A practice press wastes it. Hold the spray with your thumb on the bottom plunger and 2 fingers on either side of the nozzle. Tilt the person's head back. Gently insert the nozzle into one nostril until your fingers touch the bottom of the nose. Press the plunger firmly, all the way down. One press delivers the full dose. Naloxone takes 2 to 3 minutes to work. While you wait, breathe for them. If you are trained, give rescue breaths. Pinch the nose, tilt the head back, seal your mouth over theirs, and give 1 slow breath every 5 seconds. Watch the chest rise. If you are not trained, or you cannot do mouth-to-mouth, the 911 dispatcher will guide you through hands-only chest compressions. Press hard and fast in the center of the chest, 2 compressions per second. Watch the chest, watch the lips. If after 2 to 3 minutes there is no improvement, no breathing, no movement, no color returning, give a second dose in the other nostril using a new device. Watch the chest, watch the lips. If after 2 to 3 minutes there is no improvement, no breathing, no movement, no color returning, give a second dose in the other nostril using a new device. Today's opioid supply often contains fentanyl, which is far more potent than older opioids. It is common and expected to need 2, 3, or even 4 doses to fully reverse a fentanyl overdose. Keep going until they breathe or paramedics arrive. If the Narcan works, the person will wake up. They may be confused, shivering, or angry. This is sudden withdrawal. It feels terrible, but it isn't life-threatening. Stay with them. Keep them calm. Use their name. Tell them what happened. You stopped breathing. I gave you Narcan. Help is on the way. Speak in a low, steady voice. Do not let them take more opioids to ease the withdrawal. This can cause a second overdose the moment the naloxone wears off. Naloxone wears off in 30 to 90 minutes. The opioid in their system can last much longer. When the Narcan fades, the overdose can return. If they refuse to go to the hospital, do not leave them alone. Stay with them for at least 2 to 4 hours. Watch their breathing. If they become drowsy again, if their breathing slows, if their lips lose color, give another dose of Narcan and call 911 again. Long-acting opioids like methadone or extended-release oxycodone can require monitoring for much longer. If you must step away even for a moment, to get the door for paramedics, to grab another dose, put them in the recovery position, on their side, top knee bent, mouth angled down. This keeps the airway open and prevents them from choking if they vomit. Carry it. Naloxone is over the counter in all 50 states. You can buy it at any major pharmacy without a prescription. Most insurance covers it. If cost is a barrier, your state health department, harm reduction organizations, and many community programs distribute it for free. If you are a chronic pain patient, keep one with you. If you live with someone who takes opioids, keep one in the house. If your child, your parent, your partner, your best friend, your coworker is in recovery, keep one nearby. Tell them you have it. Tell them where it is. Take the shame out of the conversation. Shame doesn't save lives. Naloxone does. Call, spray, breathe, wait, repeat, carry it. Share this video. You might just save a life today. If you or someone you love needs help, SAMHSA helpline 1-800-662-4357, free, confidential, 24/7. Learn more about saving lives and supporting your community at unbedsidemanners.com. Thank you for watching.